Today we're beginning with acute peritonitis. Peritonitis is defined as an inflammation of the peritoneal cavity. Now, as far as etiologies go, this is most typically caused by secondary infection from a perforation within the GI tract. Another etiology includes the presence of pelvic inflammatory disease, or PID. So this condition can develop in sexually active females, and it's secondary to a variety of causes that include exposure to gonococcal organisms, chlamydia. There have been documented cases of PID developing from intrauterine devices insertion. There are times where an IUD can actually perforate through the uterus and then end up being within the abdominal cavity and creating an inflammatory response. So when turning to the symptoms and signs that can present with an acute peritonitis, the presentation itself will vary dependent on the virulence and the extent of the infection. So typically patients will complain about pain. The pain may be localized or generalized. History of vomiting and nausea. Presence of a high fever. Since this is typically linked to a bacterial organism, in most cases, it's going to be high. Usually it's above 103 degrees Fahrenheit. And we will typically have the presence, in terms of signs, of an absence of peristalsis, which would make sense since the most common etiology for this is GI perforation. Now, when we think about the information that we covered in the previous lecture material about appendicitis, and then comparing the symptoms and signs of appendicitis to an acute peritonitis, there are some differences that you can identify and recognize. So with an appendicitis, the pain will typically begin in the epigastric region or periumbilical region, then moves into the right lower quadrant. With appendicitis, the classic presentation is a brief course of nausea and vomiting, and the patient has a low-grade fever. Typically stays around 100, maybe 101 degrees Fahrenheit. Peristalsis may be slowed down because they're not eating. It may be absent, but again, not real common with the absent presentation. With an acute peritonitis, the pain can be localized or generalized over the whole abdomen. The nausea and vomiting, when it develops, it continues throughout the course of the inflammation, as well as the fever is going to be much higher than in an appendicitis. And peristalsis is typically always absent in an acute peritonitis because of looking at the etiologic mechanism. With chronic peritonitis, this is usually the result of a reinfection or from a post-operative infection. Tuberculosis is the major cause of chronic peritonitis when the condition is not associated with operations, and this would be linked to extrapulmonary forms of tuberculosis. Pelvic inflammatory disease, or PID. Now, pelvic inflammatory disease typically develops in females of childbearing age who are sexually active, especially if they have multiple partners. Etiologies include STDs, or sexually transmitted diseases, general bacterial organisms, as well as IUDs. So individuals who use IUDs have a twofold increase in the risk of developing pelvic inflammatory disease. Symptoms include lower abdominal pain, fever, chills, dyspareunia, as well as vaginal discharge. So again, those items that can be measured by the doctor would be those signs. So presence of fever, observance of chills, and upon exam, presence of vaginal discharge. There may be disturbances with the menstrual cycle as well, And this may include intramenstrual spotting, increase in menstrual flow. So definitely differences in terms of a female's normal menstrual cycle. The fever is typically over 100 degrees Fahrenheit when it is present. So definitive diagnosis is through laparoscopy. As for treatment, most women are first treated with antibiotics and pain meds, even though laparoscopy is not often initially performed. So if an organism can be identified, they're going to treat for the organism and see if it resolves the patient's symptoms. Patients should avoid sexual intercourse while in treatment and recovery. And if they're dealing with an STD, partner or partners will need to be checked as well. Abdominal wall hernias. Many hernias are asymptomatic. Some can become incarcerated, meaning stuck, or strangulated, meaning loss of blood supply. The incarceration and strangulation will cause pain and require immediate operations for surgical correction. The common treatment is usually surgical for this condition. Diagnosis of hernias is based on signs and symptoms. Abdominal hernias are extremely common, especially in males. They cause over 700,000 operations annually in the United States. Now, abdominal hernias are classified as either being abdominal wall hernias or groin hernias. Abdominal wall hernias include umbilical hernias, epigastric hernias, and ventral hernias that are also known as incisional hernias. Now, an umbilical hernia is defined as a protrusion through the umbilical ring. The majority of these hernias are congenital, although items such as obesity, ascites, and pregnancy are acquired hernia etiologies for umbilical hernias. Now, epigastric hernias typically develop through the linea alba. And if you'll recall, the linea alba is a fibrous band and it runs vertically along the center of the anterior abdominal wall, and it receives all the attachments of the oblique and transverse abdominal muscles. With a ventral or incisional hernia, this is the development of hernias at incisional scars from previous abdominal surgeries. Groin hernias include inguinal hernias and femoral hernias. Inguinal hernias occur more commonly in men, and they're located in the groin or the scrotum. Femoral hernias occur more commonly in women, and they more commonly present in the upper part of the thigh just below the groin. Now, there's one other abdominal bulge that you need to be aware of, and this is known as a diastasis recti. It's not a true hernia based on the definition of a hernia, but this condition is a bulging that's due to a separation or a non-union of the midline abdominal muscles, and it occurs above the umbilical region and below the sternum. Please review the following 2 slides for illustrations of groin hernias. The next condition is known as ileus, adynamic ileus, paralytic ileus, or paresis. Ileus is defined as a temporary arrest of intestinal peristalsis. Now, this condition occurs most commonly after abdominal surgery, especially if the intestines have been moved around quite a bit. So symptoms and signs include nausea and vomiting, as well as vague abdominal discomfort. A lot of times patients will describe it as being painful cramping, and this would be in the presence of distension. Obstipation, which is basically constipation but there's no stool material coming out at all, as well as the possible passage of slight amounts or very small amounts of watery stools. And then on auscultation, the presence of a silent abdomen, so no bowel sounds, or maybe only minimal bowel sounds. Now the diagnosis of this is typically on X-ray exam. It reveals gaseous distension in isolated intestinal areas. So it may look very similar to a bowel obstruction. Treatment consists of implementation of a nasogastric tube and administration of fluids and electrolytes. Remember, this condition occurs most commonly following abdominal surgery. So typically these patients are going to be hospitalized with this. If the condition persists for more than 1 week, now they have to be concerned about a mechanical obstruction, and that's going to have to be considered and ruled out.